Hello, my name is Emily Matthew, and in my research experiment, I examined the effect of graviola and aloe vera on high blood sugar as a natural treatment for diabetes. A little bit of background on the condition that I focus on in my experiment. Diabetes is a chronic health condition where the body cannot process glucose in the blood. So, unlike in normal conditions where the pancreas produces the hormone insulin, whose job it is to take the glucose in the blood, break it down, and then convert it into energy for the body to use, insulin is either not produced, like in type 1 diabetes, or the insulin is produced but is not able to be used effectively enough to break down the glucose, like in type 2 diabetes. There is currently no cure for diabetes, but there are various medications used to help lower blood sugar. However, this is still an issue because over 18 million Americans can't afford their prescribed medications. And because diabetes is one of the leading causes of death, with over 1.5 million deaths annually and over 142 million people currently suffering, it is important that an alternative be found quickly. The two natural remedies that I focused on in my experiment were aloe vera gel and graviola. Aloe vera gel is able to help lower blood sugar because it makes the tissues in the body more receptive to insulin. This is really only applicable to type 2 diabetes because in type 1 diabetes, insulin isn't produced at all. But if aloe vera gel was used as a supplement to a person who had type 2 diabetes, then the insulin that was originally ineffective would be able to break down the glucose in their blood and lower their high blood sugar. And then I focus on graviola because it can lower blood sugar because in the leaves of the plant, which are the parts of the plant that are used in medical treatments, the leaves of the plant have anti-hyperglycemic properties, which make it able to lower the amount of glucose levels in the blood. And the experimental model that I used in my experiment was zebrafish because humans and zebrafish have similar lipid-based pathologies, which essentially means that the way that blood flow works in zebrafish is similar to that of humans. So if there were any experimental treatments that were effective in zebrafish, they would also be effective in humans. So the problem, obviously, in the experiment is that there are millions of people who suffer from and die from diabetes each year, and there are also millions of Americans who can't afford their prescribed medications. So the objective of my experiment was to find an effective, natural, and cheap alternative to prescribed medications so that people who don't have access to prescribed medications have access to some kind of treatment that can help lower their blood sugar. And my hypothesis was that the combined aloe vera and graviola treatment would be the most effective at lowering high blood sugar in these trials. So the methodology of my experiment was to take a group of zebrafish and feed them all of the same Artemia brine shrimp, which is their normal food, to simulate a normal blood sugar. And then I split these zebrafish into 5 groups. The first one was a negative control that was only fed the Artemia brine shrimp to simulate a normal blood sugar. The second group was a positive control, fed Artemia and grinded glucose tablets to simulate a diabetic fish. The next 3 were experimental groups. The third group was fed the glucose tablets and an aloe vera treatment. The fourth group was fed glucose tablets and a graviola treatment. And the fifth group was fed glucose tablets and a combined aloe vera and graviola treatment. The zebrafish were then examined underneath a microscope to observe any visual or behavioral differences between each group, and then to measure the body mass differences of each group. A beaker was filled with a constant amount of water and then taired, and then one fish from each group was weighed separately, and the mass was recorded for each of the 5 groups over an 8-week period. So this is the data that was collected from the experiment. As you can see, the data spans over 8 weeks and includes 5 groups of zebrafish, but the data is more clearly seen in a visual representation. So in this graph, it is clear to see that the diabetic or positive control in the red is much higher and has a much higher body mass than all of the other treatment groups and the negative control. And the negative control, because it was supposed to simulate a zebrafish with a normal blood sugar, it had the lowest body mass of the experimental treatments and the other diabetic control, and it was within the range of a normal healthy zebrafish. The 3 experimental treatments were much closer to the negative control than they were to the diabetic control, meaning that all 3 of the treatments were effective. However, the one that was the most effective was a combined aloe vera and graviola treatment in the orange, as it is much closer to the negative control than the other 2 experimental treatments are. From the data in this experiment, we can conclude that the combined treatment of aloe vera and graviola was the most effective at lowering high blood sugar of all of the individual treatments. This is seen in the data because the difference between the combined treatment and the negative control with the normal blood sugar was only a 0.25 milligram difference, which was the smallest difference between each of the experimental groups and the negative control. And the difference between the combined group and the diabetic positive control was a 3.61 milligram difference, which was the largest difference between each of the experimental groups and the diabetic control. So, the combined treatment of graviola and aloe vera provides an alternative remedy that can be used in an effort to prevent diabetes from continuing to be a leading cause of death. Individuals who do have a high blood sugar and need it to be reduced immediately can, with further testing, use this treatment as a supplement to their normal diets in an effort to lower their blood sugar. And this would be an inexpensive, natural, cheap, and accessible way for people who don't otherwise have access to prescribed medications to lower their high blood sugar. If I were to continue this research in the future, I would love to focus on maybe using a different ratio of aloe vera to graviola and seeing whether a different ratio would be more effective than the ratio that was used in this experiment, and also focusing on different remedies and seeing if there are any alternative remedies that would be more effective at lowering high blood sugar. These are some of the references that I used in my experiment. And once again, my name is Emily Matthew. Thank you so much for listening to my presentation, and I hope you have a great day.